this lifestyle comes with constant triggers of stress. Like today's generation, a person gets up snoozing the alarms, skips the breakfast or has it on the run, goes to the office, not to mention the traffic they face. Then there are deadlines they have to meet, and even if a person is sitting, constantly keep thinking about the targets to be met, the EMIs they have to pay.
It feels like a big villain, right?
So these are the constant triggers, and the primitive response, which is supposed to be defensive and protective, becomes a constant trigger for stress, and there's continuous release of these stress hormones, which can cause high blood pressure, inflammation, and ultimately lead to a heart disease in the young people.
So, hello everyone. Welcome back to Heart, the show where we bring real life heart talks closer to you. Now, let me ask you this. When you hear high blood pressure, what's the first thing that comes to your mind? Grey hair? 50s, 60s, right? Well, guess what? That's changing and fast. More and more people in their 20s and 30s are being diagnosed with hypertension. Shocking, isn't it? So, today we are going to bust some myths, spot the warning signs, and actually learn what we can do about it. And to guide us today, we've got Dr. Ravi Chauhan, MD, DCARD, sports medicine preventive cardiologist, and heart failure specialist who's been working closely with young patients and helping them reverse their early heart risks. So, Doctor, thank you so much for joining us today.
Thank you. It's my pleasure. So today we are going to discuss about lifestyle diseases and how they lead to heart disease in the long run. Our focus will be around discussion of high blood pressure in young adults.
So, usually high blood pressure is an after 50 thing. So, why are young adults diagnosed with it?
See, you're true. There's a common belief that heart disease or high blood pressure is the disease of old age. But I still remember we were in college as medical students, maybe 2 or 3 decades ago. We used to be told that heart disease or high blood pressure is the disease of old age, or grandfather's disease, what we call it. But in the last 2 decades, the time has changed, the pattern has changed, and we see high blood pressure or heart disease even in young people in their early 30s or 20s. Even in college students, it's common to have a high blood pressure.
College students, that's really scary.
Yes, it is. We commonly come across high blood pressure in young adults, even in college students, because of the poor lifestyle choices, poor eating habits, lack of physical activity, constant stress, late nights. All this can contribute to high blood pressure or heart disease in the long run.
But hold on, doctor. What if someone looks healthy, like they're fit, gym going, Instagram ready, and they still have blood pressure?
Yes, absolutely. A person can look fit from outside but still can have a high blood pressure. Like we refer to a common proverb that we should not judge a book like by its cover. Same way, the external looks is not decisive on high blood pressure, and most of the times a person can look healthy from outside. He can go to the gym, have six packs, have a muscular body, but still his BP can be 150, 100 or more.
One what? No way.
Yes, it is. So the thing goes like a person can look fit from outside and still his BP can be high. A person can be obese or unhealthy from outside, but still his BP can be normal. So external looks are very deceptive when it comes to high blood pressure or heart disease.
Right, I truly agree. Okay, so let's talk about signals. Are there any little hints that the body gives us?
Unfortunately, no. High blood pressure, diabetes, high cholesterol, these are labeled as silent killers, and most of the times the patients are completely asymptomatic. A person can have a high blood pressure of maybe 200 or more and still be completely normal. He can carry out his day to day activities without any trouble. So, when it comes to high blood pressure, there are a lucky few who can have some symptoms like early morning headaches, heavy headedness, a sense of imbalance. They can have nosebleeds when the BP is really very high. Some people can have breathlessness and feel fatigued throughout the day. So these are the warning signs which may be there in a small number of population, but most of the times, as I said, high blood pressure is a silent process, and the people are not having any complaints.
Right, I feel some people just brush these signs off.
Agree.
Now, coming to stress, it feels like a big villain, right?
Correct. The human brain has a primitive instinct. We call it a flight or a fight response. So this response, stress response, is more of a preventive mechanism which we get from our ancestors. So it was mainly to defend a perceived threat. So whenever there's a situation arising where we have to either fight it out or run away from it, there are stress hormones which are released from the body, which increases the heart rate and increases the glucose in the body, so we can fight the upcoming problem. But what happens in the modern lifestyle is, with urbanization, the global landscape, social as well as environmental, is changing. And to adapt to this changing environment, we have to catch up with the lifestyle. And this lifestyle comes with constant triggers of stress. So, the one which is supposed to be a preventive mechanism of response to stress, we are constantly triggering those responses. Like today's generation, a person gets up snoozing the alarms, uh, skips the breakfast or has it on the run, goes to the office, not to mention the traffic they face. Then there are deadlines they have to meet, and even if a person is sitting, constantly keep thinking about the targets to be met, the EMIs they have to pay. So these are the constant triggers, and the primitive response, which is supposed to be defensive and protective, becomes a constant trigger for stress, and there's continuous release of these stress hormones, which can cause high blood pressure, inflammation, and ultimately lead to a heart disease in the young people.
Right, and eventually body pays the price.
Exactly.
So, can you give us a real life story, something that our listeners can actually relate to?
Yes, of course. So I'll give you a comparative situation where we deal with high blood pressure on almost on a daily basis in our OPD.
Right.
So there are two young executives around the age of 30-year-old, both present with high blood pressure of more than 200 millimeters of mercury. Both are completely asymptomatic. So when one person is questioned, one out of the two, he's a 30-year-old, he's a pilot changing his job on the airlines, and he comes for a pre-employment checkup, and his BP is found to be high. So when questioned, he says, my BP was absolutely normal when I left from home. And when he comes to the clinic, in the doctor's room, his BP is found to be 200. We do his ECG, we do his 2D echo, everything is absolutely normal. So this is the common response to stress, and the BP is triggered because of the stress of employment, or maybe if they are labeled unfit, they lose the job. So this is what is going to rise their BP, what we commonly refer to as a white coat syndrome. So this is something which we cannot label it abnormal, and the person is fit and fit to join his flying duties. The same case with the other person who comes with a BP of say 160, 100 or 200. When we question him, he is a young executive working with a corporate, has 10 to 12 long working hours every day, no physical activity, all the meals are outside, sleep is compromised up to 3 to 5 hours every day. So, and when he is questioned, he mentions that the last time when he visited his doctor for fever, his BP was found to be high, and his doctor asked him to follow up in the OPD after the fever is gone, but he failed to do so. And now he comes with a high blood pressure. So this is purely something which is ignored. He is having blood pressure for a long time, and now his BP has really gone high, which needs some attention. Okay, so when we start treating blood pressure for the first time, we always give 3 months to 6 months for the patient to work on his lifestyle. So this particular patient, which I'm mentioning, we put him on a lifestyle modification. We call it a therapeutic lifestyle modification, where we focus on mainly on his diet, eating habits, and his lifestyle. So a good sleep, regular walk of 30 to 40 minutes, uh, eating home cooked meals. All this brought down his blood pressure to a considerable extent, and he didn't need any medicine. He was further on weight reduction and lifestyle modification, and we could manage to control his BP without any medication, just on a lifestyle modification.
That's incredible. Like just lifestyle changes?
Yes, just lifestyle changes. So it's mainly about our dietary habits, our sleeping habits, and the exercise habits. Okay, so all these three contribute in the long run in a great way to be free from disease and high blood pressure.
Right. Okay, a question, doctor. So people say that I don't eat oily food and they think that they are safe. Is it true?
See, it's just not about the oil you use. So in general, all the oils are bad. It's not that one oil is better than the other. Uh, but what we should focus on reducing the quantity of oil we use, and any oil going on the frying pan is going to be bad. So, and also, it's not just about the oil, it's about the packaged food. So every food preserved which comes with a shelf life, it is preserved with salt and sugar.
Right.
Okay, so all this packaged food, chips, what we commonly eat, all this come with a huge amount of salt and sugar to it. Okay, so this is what we should be focusing on. A single packet of salt can, a single packet of chip can be more than half the amount of the daily salt intake you have.
Right. I think all of us young generation are so guilty of it because a packet of chips is like, it's very negligible and we often don't notice about it.
Yes, as I said, most of the packets of chip come with a shelf life, and the commonest preservative which is used is salt in it. Because you should watch the amount of chips you take. Once in a while, it is okay, but it should not be a part of your staple diet. You should not have chips or pickles or papads. These are common salt sources which we have, and we tend to have pickles guilt free all the 3 meals of the day. So this is what we should watch for. Okay? From there, the hidden salt comes in, and which ultimately is going to contribute to the high blood pressure.
I think all of us are guilty here then. So, doctor, if someone's recently being diagnosed with hypertension and they have been prescribed with medicines, so is it कि उनको जिंदगी भर medicines लेनी पड़ेगी?
No, that's not true. Like we discussed in the previous case, lifestyle modification itself is one of the pillars of any treatment of high blood pressure. So it depends on at what stage of blood pressure we started the treatment. So if it is very initial phase where the BP is say 150, 90, we put him on a lifestyle modification along with the pill to avoid the long term side effects or long term effects of blood pressure. Okay, there's something called as hypertension mediated organ damage. So if the BP is not treated, it can affect the heart, it can cause enlargement of the heart, it can affect the kidneys, it can affect the eyes. We call it hypertensive nephropathy, hypertensive retinopathy. To avoid all this end organ damage, we do have to treat the blood pressure first. So as with passing time, the patient loses some weight or improves his lifestyle, watches his salt intake, so we may want to reduce the blood pressure medications over time. And if they are successfully uh, treated, and in the long run, we can also stop the blood pressure medicine, provided the BP starts going below normal and we have to step down titrate the medication, or we can stop it altogether. It all depends on how the patient responds to the BP medication.
Okay, thank God, like it's not a lifetime thing then.
Yes.
Okay. So I have to ask you this. What's this one weird case that you have come across in your practice?
Okay, let me answer this. Uh,
Yes.
it's not surprising though, but I'll try and give you two situations where a 70-year-old and a 30-year-old both have undergone an angioplasty, and they are right beside each other in the ICU on the beds. Both have had a stent in their heart. Okay, so on detailed history, I would like to share that this 70-year-old, he went for a stress test checkup a month ago. He is suffering from high blood pressure and diabetes since more than 10 years, which is well treated with medications. So one fine day while walking, he feels chest heaviness on climbing or walking uphill and climbing a few flight of stairs. So he goes to his doctors, and who suspects a heart disease. So he's sent for a stress test, and the
Okay.
stress test comes abnormal. So he goes to a cardiologist, undergoes an angiography, found to have a 90% block in the arteries, and undergoes an angioplasty, and he's fine, stable now. The
Okay.
same patient, 30-year-old, he also underwent a stress test a week back. His ECG, his 2D echo, his stress test was all normal. He ran a half marathon a month
Okay.
ago, and still while traveling on a local train, he suffered a chest pain, profuse sweating, went to an emergency, and was found to have a heart attack.
Oh my
So
God.
yes, so in both the cases, both have undergone a stress test. One was normal, he still had a heart attack. The other was a 70-year-old abnormal, and he didn't have a heart attack, though he had to undergo an angioplasty. So what's unique in this case to note, or weird as you ask in this case is to note, is heart attack or heart disease is not about how much
Okay.
percentage of block a person has. Okay, a person can have a 90% block which has grown in his body over last few decades from 10% to 20%,
Right.
gradually to 90%. So these blocks, when they grow to more than 70, we call it obstructive lesions. So
Okay.
when they grow to this obstructive level, they'll start troubling you. So till the block is less than 50, 60, 70%, you may not notice also. You carry out all your routine activities without any trouble. But when they cross this mark of say 70, 80%, you will have start having chest pain on walking or climbing uphill. This is called as angina. So this is what happened with the 70-year-old. But in the other case where the stress test was normal, he was 30-year-old, he was hypertensive, which he didn't pay heed to. It was not attended. He was pre-diabetic, had a bad lifestyle, had a smoking habit. So what he had is not a 90% lesion in his heart. He had a 30 to 40% plaque in one of his main arteries, and this plaque ruptured. And whenever there's a rupture of plaque in the artery, it is identified as a lesion, and the body tries to heal the lesion with a clot. Like we have a cut on the skin, we see a clot coming after 2 days. The same process happen inside the arteries where the plaque ruptures and body wants to heal it. But since it is a closed space, the entire thrombus closes the artery and the person suffers the heart attack. So what point I want to make is a person with a 90% block may not have a heart attack, and a person with a 30 or a 40% plaque may have a heart attack due to plaque rupture. And most of the heart attacks happen in people who have blocks less than 50%. Okay, so we should not be sitting home thinking that our tests are normal and we should not see a doctor. So whatever the test results are, you should always discuss with your family doctor or a cardiologist, especially those who have strong family history of heart attacks in their family. Maybe parents or brothers sisters have had an angioplasty or a heart attack, or those who are living with bad lifestyle like uncontrolled sugar, high cholesterol, smoking, and high stressful life. Okay, so the point here to make or to take home message is heart attacks don't happen due to blocks which are 90%. It can happen in even a 10-20% blocks. So we commonly have these news headlines nowadays: young celebrity dying, dropping dead of a heart attack. So this is what happens. It's they may have all the tests normal, they still may have a plaque rupture and suffer from a heart attack.
Right. So true. It literally gave me goosebumps. So, doctor, when we talk about celebrities, they have such healthy lifestyles, good routines, and we randomly hear that they just collapse.
Agree. So this is very common nowadays. To answer this question, I already gave the example of that weird case where we had a plaque rupture in a young
Right.
patient and he suffered a heart attack. So again, we have to understand how the heart works to understand what happens when the person collapses. So it's not only about heart attacks. There's something called as arrhythmias. There's something called as cardiac arrest. So heart is a system of heart is an organ where three systems are integrated with each other. Uh, Let me give
Okay.
you an analogy of a car. If you drive a car, there's an ignition. Once the
Okay.
ignition starts, the engine starts running. Once the engine starts running, the petrol starts flowing.
Correct.
In the same way, in the heart, there's a small, say, current which is generated from a node which is called SA node. It's like the ignition of the car. Okay,
Hmm.
so that starts the heartbeat. So the heart has this all inbuilt wiring system, like we have concealed wiring in the walls. Same way, there are wires inside the heart. Okay, so whenever the heartbeat is generated, it runs to the heart and makes the heart beat as a pump. Okay, so like I gave you an analogy of the ignition of the car. This is what we see on the ECG commonly. We see the heart electrical activity of the heart. Then second comes the engine of the car. Like the engine makes the car run, the same way the heart functions as a pump. So when the electricity is generated, the heart pumps the blood into the body. And for the heart to pump continuously, like we have 60 to 70 beats in a minute, 4 to 5,000 beats in an hour, and say in a day the heart beats for almost more than a lakh times. Okay, so for the heart to function as a pump, it will itself need a fuel. So that's what we refer to as the petrol supply to the car. So there is a ignition, there's a pump, and there's a blood flow.
Okay.
So when there is a problem with the ignition of the car, uh, that's where the
Hmm.
heart disease is born out of the electrical activity. So someone may have a heart block and the heart may stop beating. So he may not have a block in the artery. His heart may be completely fine as a pump, but there is no heartbeat generated. So that is where we use pacemakers for the heart. Second is heart as a pump when it fails. So it can fail due to commonly which we came across during COVID. An infection can cause heart failure. The heart muscle becomes weak due to a heart attack or long-standing diabetes or high blood pressure. And lastly, the fuel supply. So when the blood supply to the heart is compromised, like we refer to as blocks in the arteries, so these are three different systems. So if a cardiac arrest can be due to the electrical activity of the heart, it can be due to a heart attack, or it can be due to the pump failure. Okay, so these are three different systems. That's how we have to understand the heart. It's not only about blocks in the arteries, but yes, and uncontrolled diabetes and uncontrolled high blood pressure, high cholesterol, this all is going to contribute to all these diseases in the long run.
Right. So, doctor, I have to bring this up. Late night parties, alcohol, smoking, do they add to the problem?
Yes, Geenam, they do. So when it comes to alcohol or smoking, this can be direct contributors to high blood pressure or causative for atherosclerosis, which ultimately will lead to blockages in the arteries of the heart.
Okay.
So whenever we are doing a risk profiling of an individual, uh, it becomes a very important part of the lifestyle modification. So smoking can be a direct cause, and reversal of smoking can reverse the heart disease. Also, when it comes to alcohol, we do allow alcohol in moderation. So like you can have two small drinks every day for 5 days in a week, but it
Okay.
should not be that I didn't have drinks for 5 days and
Right.
at the weekend I'm going to binge on all the 5 drinks. So that is definitely going to affect the long.
So, can drinking coffee every day actually raise your blood pressure long term?
See, everyday drinking coffee may not contribute to the blood pressure, but if you have it in excess of more than one or two drinks in a day, it's definitely going to increase an already existing blood pressure. It won't be causative for blood pressure, but yes, it can contribute to a faster heart rate and high blood pressure.
So, is it true that meditation can lower BP or is it just a myth?
Meditation definitely can lower the blood pressure. It works through the autonomic nervous system where we don't have control of your heart rate or heartbeats. The same way meditation works through the autonomic nervous system, and it can bring down the heart rate, but it can not be solely a treatment purpose. It can add value to the already existing treatment as a part of lifestyle modification.
How dangerous are energy drinks for young people when it comes to blood pressure?
Definitely, energy drinks are dangerous. They kind of fool our system to keep it awake, and it can increase the heart rate and blood pressure for sure if taken in excess.
So, what role does love, friendships, and emotional health play in keeping blood pressure stable?
Emotional health is also a very important part of having a healthy lifestyle. So it does contribute in a long way, and it will add value to the better numbers of high blood pressure or lifestyle diseases.
Okay. So, can someone ever fully reverse high blood pressure or is it just a lifelong risk?
Definitely, we can reverse the high blood pressure, identifying the cause of it. So, if there are reversible causes, we can definitely address the causes and reverse the blood pressure completely, provided we detect them on time and treat them on time.
Correct. Does living in big, noisy city put you at a higher blood pressure risk compared to a calmer town?
Definitely, big, noisy, busy cities are continuous triggers for our stress response, which in return will cause increased heart rate and increased blood pressure. So, yes, a cooler, calmer environment will always be better as compared to a big, noisy city.
Right. How quickly can blood pressure improve if someone changes their lifestyle today?
BP can start improving within 24 to 72 hours just by restricting salt intake and by increasing the physical activity. So it does respond to lifestyle modification.
Okay. Are gadgets like smartwatches and fitness trackers really reliable to blood pressure monitoring?
Yes, for home monitoring blood pressure, it is definitely reliable. Not watches though, but the home monitoring machines are reliable. Watches are good for identifying heart rate and our physical patterns.
What's worse for blood pressure? Lack of sleep or junk food?
Both are equally worse.
Okay. Big question, doctor. So, what's the ideal age the audience should come to you and check their blood pressure?
So, as I would say, whenever someone turns an adult, say 18 years old, when you start planning your driving license or a voting card, that should be the right age where you should get yourself checked. Okay, so whenever we are checking what are the important lifestyle diseases young people are suffering are high blood pressure, diabetes, high cholesterol, because these all in the long run, if they are untreated, they are going to contribute to a heart disease.
Correct.
Okay, so you should plan a health checkup when you turn 18.
Okay, so even though I am being a Gen Z, we don't listen to our parents, not even doctors. So, what's your advice for us?
Right, Jinam. So I would say, like when you buy a car, uh, every car, any model, it need a servicing at least once in a year.
Okay.
Okay, so imagine the heart as an organ which is working 24/7. Even if you're sleeping, you are awake. So we also, as the heart, as the whole body, need servicing. So that comes in form of at least a routine health check once in a year. Okay, say like heart is a marvelous organ which beats every second. So on an average, if someone is having a heartbeat of 60 to 70 beats per minute, so in an hour the heart beats for almost 4 to 5,000 times. In a day, it is 1 lakh heartbeats. So suppose you are having a high blood pressure, high sugar, or high cholesterol, you're exposing your heart to this kind of abnormal values one more than 1 lakh times in a day, and then make it 365 days in a year. Okay, so definitely it's going to affect the heart in the long run. And initially, the problem, as I said, these are all silent killers. So they don't give us any signs or any troubles. You can carry on your day-to-day life with high blood pressure, diabetes, or high cholesterol. But if it goes untreated for a long term, it will leave an imprint on the heart, and most of the time it is diagnosed when it is already irreversible. The damage is done. So I would advise, like we service our car every year without any trouble, same way proactively we should be able to do our health checkups regularly, fix our lifestyles, and try and live a healthy lifestyle so that we can make the heart run as an engine for the long time. Right. Without any disease. Right. As a part of Gen Z, I guarantee you to do that. And even the audience does. Well, yeah. So before we wrap up, what's your one message for our young adults out there? Like we have learned in school, prevention is better than cure. So let's take charge of our own health. Let's know our numbers. Okay, let's know how much your height, weight, BMI, our blood pressure, how cholesterol, and our numbers are. And let's take charge of your own health. Yeah, we are always there in case of any questions, any queries, or any emergencies.
Beautifully said, doctor. Thank you so much for this reality check. Thanks a ton.
Thank you, Jinam, for having me on the show. It was wonderful conversing with you.
To our listeners, remember, blood pressure isn't waiting for grey hair. So start early, start small, and be consistent. And don't miss our next episode. Until then, breathe deep, walk often, sleep on time, and protect your pressure.